Hey, I see your new patches.
Looking pretty snazzy, right?
Yeah, now it's official.
Hello, Mr. Yim. How are you doing? Got a lot of people in the waiting room. It's good turnout. Hi, Leanne.
Hello. Sorry.
Hey.
Hi.
Hello, everyone. Nice to see you all again.
You too.
Welcome.
Yeah.
It's like our monthly fix now.
Yeah, absolutely.
Okay, we are recording. Okay, everything's going. All right. Perfect. Welcome, everyone. I guess we can start. Mr. Chow, over to you.
All right. Good evening, everyone. Hopefully everyone had a good day today. It's sunny, so hopefully you got to go outside for a little bit and get some fresh air. So we're going to have another trivia question for you guys. It's trivia time. So what we'll like to do is see how much you know about St. John history. And tonight's question is, Mr. De Leon, which individual has not been the sovereign head? King Edward VII, King George VI, Victoria I, or William IV? Good luck. We're going to throw up the poll. So if you like to put up your answer there. All right. I think that's enough time because you should know your St. John history by now. All right. So, which individual has not been the sovereign head? And it's King William IV. King William IV was a ruling monarch prior to Queen Victoria. She was really impressed with the work of St. John Ambulance. And in 1888, she constituted by royal charter the most venerable order of the Hospital of St. John of Jerusalem, or the Order of St. John for short, and as a British Royal Order of Chivalry dedicated to St. John the Baptist, thus making her the first sovereign head of St. John Ambulance. So all the monarchs after her were the sovereign head, and King William IV, being prior to Queen Victoria, has not been the sovereign head. St. John Ambulance honors the long service of its members with the Long Service Medal. It's the only medal in the British honor system that has a likeness of Queen Victoria on it. So the next question is, who is the current sovereign head? Does anyone know? It's Queen Elizabeth II. So currently she's the sovereign head of St. John Ambulance. So that is the trivia. Hopefully everybody learned something. Thank you for bearing with us.
Well, thank you, Mr. Chow. This is, as I said, is a very unique way of connecting our members in BC here. And before we begin the official program, I'd like to take this opportunity to wish our Superintendent, Mr. Chow, happy birthday. We're gonna do a little something for him here. He's not expecting this. So we're gonna sing him happy birthday. So if you have a light or anything, or candle or flashlight, or your cell phone light, which I'm doing here, let's shine a little something here. There we go. And if you don't mind joining me in singing happy birthday to Mr. Chow, it's going to sound funny because we're all kind of in a different setting, but that's okay. So we'll do our best here. So Mr. Chow, he's celebrating his, I think it's his 25th birthday, right?
No, 16th.
16th. There we go. I knew there was something. There we go. So if you all would like to join me in a big loud voice to unmute yourself and join us to sing happy birthday to Mr. Chow. In a 1 and a 2 and a 1, 2, 3. Happy birthday to you.
Happy
Birthday to you. Happy birthday, dear Chow.
Happy birthday
to you. And many more. There we go. Thank you. Woo!
Okay. Thank you, everyone. That was great.
I'd like to introduce our Burnaby team. You just already met Mr. Chow, our superintendent, and Mr. Ahadzadeh. If you guys would like to do a quick hello.
Sure. Mr. Chow, please.
Yeah, you do the honors, Mr. Chow.
Hi. My name is Raymond Chow, and I'm the Divisional Superintendent of 389C in Burnaby.
Hello, everyone. I'm Farhang Ahadzadeh, and I'm the Divisional Superintendent of Division 304 in Burnaby. Thank you.
Thank you, Mr. Chow. Thank you, Mr. Ahadzadeh. I see Mr. Lowe.
Hello, my name's Tony Lowe. I am the NCO Development Officer at Division 389.
There is Ms. Ho and Ms. Huang.
Hi, good evening. And my name is Eva. I'm the admin officer.
Hi, everyone. I'm the training officer for Division 389C. I'm Garfield. Nice to see everyone come back tonight.
Okay, I see Mr. Liu. Vincent Liu.
Hi, good evening, everyone. I'm Vincent. I'm a CSC of Division 389. Nice to meet you.
Mr. De Leon.
Hi, good day, everyone. My name is Ian De Leon. I do special training and I host these events, so I'm really excited to be here tonight.
It's great to have you here. Right beside him, I see our NCOs, Corporal Butler.
Hello, everyone. I'm Corporal Butler from Division 389.
Okay, thank you, Corporal Butler. And Corporal Chen.
Hello, everyone. I'm Corporal Carmen Chen. I'm from Division 389.
Okay, and right beside her, I see from PHQ, I see Leanne Strachan.
Hi, guys. I'm having some technical difficulties here, and I can't get my picture back up, unfortunately. But nice to be here. Always an honor. So just looking forward to the show tonight. So good luck with everybody.
Thanks, Leanne. Letitia.
Hello, I'm Leticia Sanchez. I'm the president of the Vancouver AsianHeritageMonth Society. And with that, May is coming so soon, and we are going to celebrate Asian Heritage Month. I invite you all to celebrate with us. I will drop in the chat the program for Asian Heritage, and don't forget to join us on May the 1st for the opening, the illumination of City Hall and other venues in Vancouver. And we are going to have lots of wonderful events to celebrate not only East Asians, but North Asia, the Western Asia, the subcontinent, and South Asia. So remember, there are 48 countries in Asia, and we celebrate all of them during the month of May. So in a minute, I'm going to share my the link to the program, and I hope to see you all at the opening of Asian Heritage Month this May the 1st. Thank you.
Thank you, Letitia. All right, looking forward to that. Right beside her is Rahul from PHQ.
Hi, everyone. This is Rahul, and as many of you guys know, I'm here from the PHQ. I'm the fundraising, events, and promotion specialist from Community Services and Fund Development. So you will probably see with one of my wonderful team members, and Jane here as well. I work in the whole team and excited to see Speaker Series again. Thank you very much. Back to you, Richard.
Well, thanks, Rahul. It's great to have you here. I see our Lower Mainland Area Commissioner, Frederick Yim, is here as well.
Hello, everyone. My name is Frederick Yim. Yes, I'm the Lower Mainland Area Commissioner, and good to be here. Thank you.
Thank you, sir. I see the Lower Mainland Fraser Valley area. It's a long one. Administration Officer. Ms. Froment, you're here.
Hi everyone. Thanks, Richard. Yeah, very long title. In short, it's Area Administrative Officer for Lower Mainland Fraser Valley. Thanks, everyone.
Awesome. Thanks, Ms. Froment. Right beside her is our main speaker. I'll let you say a very short word because everyone's going to hear from you in a moment. But if you'd like to introduce yourself quickly, Mr. Leung.
Hello, everyone. Thank you very much for joining tonight. So my name is Ralph. I am the 426 Richmond Division Superintendent. So good to be here. And thank you very much, Burnaby Divisions, for hosting tonight, having such a great platform for me to speak.
Thank you, Mr. Leung. It's great to have you here.
Thank you.
I'm just going to go to the next screen to see if I'm missing anybody. I think Jane just joined us. Is that right? I'm just going to...
Yes, hello. It's nice to see you. And sorry I was a little bit late joining. It's good to be here.
Well, welcome, Jane.
Thank you.
I see, just give me a second here. I see our Commissioner Valentine has just joined us. Commissioner Valentine, sir, we're just doing the self-introductions. So over to you, sir. It's your turn.
Good evening, everybody. It's David Valentine, Commissioner of BC and the Yukon. Nice to see so many familiar faces. And I'm looking forward to starting this meeting tonight. I have 2 board meetings as well tonight. So if I disappear, it's not because I'm bored. It's because they want me to do something else.
We have a lot of people here today, so this is fantastic. So if you can turn on your cameras, I'm going to give you 30 seconds to turn your camera on, straighten up your ties, your array, polish your shoes in the meantime. Yeah, there we go. Okay, so give me a second here as I get the screenshot set. So everyone look straight into your cameras and we'll count down to 3, 2, 1. Okay, thank you. Let us begin the official program. Mr. Ahadzadeh, over to you.
Welcome back to another exciting series. I hope you are all well. I'm Ahadzadeh, Divisional Superintendent for the Adult Division 304, based here in Burnaby, BC. Before we begin, I invite the members to keep their headdress on and remain seated. And please keep your mics muted, especially when our special guest is speaking. If you have any questions, please raise your digital hands. Thank you. I would like to now invite our Honorary Brigade Division President, Mr. Richard N. Liu, to say a few words.
Thank you, Mr. Ahadzadeh. Good evening, everyone. If you haven't seen our previous events, you can find them all on our growing YouTube channel. Click that subscribe button down here and hit that bell to be notified when we're posting new videos. If you're new to this channel, you can always navigate our videos easily with the timestamp chapters in the video description below. Now, before we begin, I would like to acknowledge and recognize that our division is proudly based here in this diverse city of Burnaby, which is located on the ancestral and unceded homelands of the Coast Salish. We are grateful for the opportunity to present the speaker series on this shared territory tonight. Mr. Chow, over to you.
Thank you, Mr. Liu. Good evening, everyone. My name is Raymond Chow, and I'm the Divisional Superintendent of St. John Ambulance, Cadet Division 389. We are based in Burnaby, located right next door to Vancouver. We are quite excited to begin this evening with a very warm message from our interim CEO of St. John Ambulance, BC and Yukon, Mr. Ken Leggatt. Mr. De Leon, if you please. Thank you.
Hello, everyone. It's great to see you all again. Thank you for having me and allowing me to start off this evening. I hope you've all been enjoying the spring weather while staying safe and well. I'd like to send my greetings this evening to our special guest, Mr. Ralph Leung, who is a Divisional Superintendent for Division 426 of Richmond. Not only is he a dedicated SJA volunteer, but also an incredible innovator in medical technology. I am thrilled to attend tonight and hear all about his experiences, and I'm sure the many stories he has to share. So thank you once again to the Burnaby Division for holding this wonderful speaker series, for not just our youth, but for our members of SJA community and beyond.
All right, thank you for that very wonderful message. I would now like to invite Provincial Commissioner Valentine to welcome and introduce our guest speaker, Mr. Ralph Leung. Commissioner Valentine, sir.
Thank you, Superintendent Chow. And it's another speaker series. I look forward to these. It's always a surprise to see what's going to happen and who's going to say what. And of course, the ice cream choice at the end is one of my favorite pieces of this, being that I love ice cream. And tonight it's my pleasure to introduce Mr. Ralph Leung, who is the Richmond Division Superintendent. I'm sure that he is going to entertain us for the evening. And with that, I'll give you Superintendent Leung.
So again, thank you very much, everyone, for joining tonight to come and listen to my presentation. So as we all know, that it is a difficult time right now, and we all know about how the medical field is being overwhelmed. And we all know about doctors, nurses, and who has heard of Medical Lab Technologist? So I'm actually going to be setting a poll later, and just want to get everyone to be involved and basically let me know who has heard of this job. But first of all, just a bit of introduction again. So my name is Ralph Leung. I am the Divisional Superintendent, Richmond Adult Division 426. So I have joined Richmond Division since 2008, around November, I believe. So it's been a good almost 12 years. I can't do math. I'm really bad at math. When I am not volunteering, my job is being a medical lab technologist. So I started working at VGH back in 2012. So it has been, again, I can't do math. Is it 8.5 years, around there? So the most recent new job I got was actually at a BC Cancer Agency. So it's a new challenge. It's something that is absolutely very different, but the job is great. It's definitely very rewarding. So I'm gonna basically tour everyone and let you know what I've been doing or how medical lab actually is like. So some of the topics I'm going to go through tonight. So what is a medical laboratory? Some of the medical lab technologists' responsibilities, the significance of a medical lab during the COVID times, some case studies, and then questions and answers. So here's a part, I actually didn't know that in Zoom you can actually do a poll, but I set up a link. If everyone can help me out here and go to this link that I posted and just answer this question. Can everyone see my screen right now?
We can, yes, thank you.
There we go, thank you very much. That is some great music. Okay, so thank you very much for all your responses. I'm actually going to be posting right here. So I'm getting 37 responses. So 24 said yes, 5 said no, and 8 people said, oh, maybe, but definitely heard of lab rats. So that is great, because honestly, I was expecting a lot more, a lot less people heard of this job title. Okay, so that jumps to the next slide. Okay, so what is a medical lab technologist? From what we can see here, I'm pretty certain my parents would see me as someone working in the lab, playing with blood, having a microscope in the background, very focused. So yes, patients, on the other hand, see us being the vampire, because everyone knows that most of the testing we do is blood. So we have to draw the blood, and people keep thinking that we're vampires. Well, honestly, no, I don't draw blood myself. I know how to, but I'm not. So what about friends? Probably mad scientists, crazy scientists, holding on flasks and chemicals, pouring chemicals, somehow magically there's some results. Pretty common. This is how we see ourselves, very, very professional in all the lab coats, with all the instruments in the back, taking a very professional picture. This is absolutely the best picture. How the world see us? Probably like that too. Whenever there are some results, it would be like, yeah, saying yes. No, we don't do that. What we really do, this is very true. I work right here. My partner will work right here. Someone will look in the microscope. I do something else. That is the real world. That's what we do. So we have a lot of different people viewing us differently. Great. So I'm actually going to talk about what I actually do later on. This, I'm going to show a picture of not me, and I have to admit that when I started, when I was a student, funny story is that I actually fell asleep, and my trainer didn't know that I fell asleep in front of the microscope. And my partner actually kicked me, and I jumped up, and it's like, oh, what's going on? Nothing. Keep looking at the microscope. And it's actually a pretty tiring job. When you spend a whole day looking at the microscope, it's actually pretty straining on the eyes. So don't worry, I don't fall asleep in my job. This is definitely not me. I need to clarify. Okay, so now what is a medical lab? So a medical lab is basically primarily designed to process and analyze human specimens. So when it comes to human specimens, we're talking about like body fluids. Majority of the specimen that we analyze is blood. A lot of them is also urine. Feces, not the best thing to analyze. So we also look at body tissues and a lot of other things too, but these are the major specimens that we look at. So now, why do we analyze all these specimens? The whole idea is to get the lab results. So the end product is the lab results, and we want to get these results to the physicians. So why is it so valuable is because a lot of diagnoses are actually made based on lab results. So that's why a lot of times doctors cannot fully make a diagnosis without a lab result. So this is something that we take pride of. because we want to make sure that we give the best, the most accurate lab results. So something that we do too, and currently what I'm doing actually is to prepare the life-saving products. So the lab that I'm working right now is basically preparing the stem cells. In your blood, there are some stem cells, and we prepare these cells and then give it to patients who are going through, they're having blood cancers, basically. So we would administer these products, and we actually have to prepare them first. So that's the main job that I need to do. So where do you see a medical lab? Basically in all hospitals, depends on the size of the hospital. VGH, obviously, the biggest hospital in BC, so it's very well equipped. Whereas in smaller hospitals, they might not have a full functional lab, and a lot of these tests or samples would actually need to be sent to other hospitals or labs. So also there are some private labs. A lot of people might have heard of Life Labs. So Life Labs is actually a private lab. So it's not limited only in the hospital setting, but there are also other labs outside. Now, another question that I want people to help me answer. Let's take about 1 minute if you can get into the link and answer this question. Have you had a blood test before? Okay, thank you very much. All right, so let's take a look at the results. Okay, so I see 40 people answered. And 32 people answered yes, and 8 people answered no. Okay, so about 80% of people actually had a blood test before. So that is great. So basically, a lot of people, it doesn't need to be when you're unhealthy that you need to do a blood test. A lot of people actually are very healthy when they do a blood test. For various reasons. Okay, so some of the specimens that we get or containers that we use. So again, a lot of samples that we get are blood samples. So if you had your blood test done before, you might have seen these blood tubes on these ones right here. And these are also having blood in there. So these are blood cultures. So just a different kind of container. This one here, it's a urine container. If you ever had your urine tested, you might be familiar with the orange container. The poop, I'm not going to put a picture of poop inside a container because I think a lot of people have had a dinner just now, so I don't want to gross people out. But essentially, it's kind of like this container too. Also, there are different kind of containers. There's actually hundreds of different containers to contain specimens. But yes, feces, that's one of the things that we test. And right now, a lot of attention goes to the swabs. So this is going to go to the virology lab. So before sending to lab, you would have nurses or someone who's trained to do to take a sample from the nasopharyngeal. So basically, the swab is going to go into a container and being shipped to the lab. So now all these specimens are going to go somewhere into the lab. So they're going to be tested. So I took these pictures about 7 or 8 years ago, so they might be kind of outdated. But essentially, this is a location where the lab reception is. So all the samples would go into this location. So before showing a picture, basically the lab reception has a lot of medical lab assistants. So my role as a technologist is to analyze samples, but there are a lot of these assistants that are actually behind the scenes to help sort and organize the samples before each department can do the testing. So also they do a lot of the blood collection. I know how to do blood collection, but I haven't done it for 5-6 years. The assistants actually do most of the job. For small hospitals, some technologists might need to do it, but a lot of technologists in big hospitals don't do it. So now the lab assistants, they receive the specimens, they enter it in a computer so that it generates a label. So each specimen has a label and has to have the right, what we call patient demographics. So now once they have a label, they have all the information, they're going to be delivered to different departments to get analyzed. Now this part is very important, the patient identification. You would be amazed how many errors can be done throughout the whole process of doing analysis. From the time of actually labeling sample, a lot of errors can be done. So we stress a lot on making sure that labeling has to be correct. Okay, so again, this is VGH. This is the lab reception. So this area, there are about 10 computer stations. So on a day shift during the day, you would have a bunch of people running around here, sorting samples. So it's a very crowded area. So we have one lab assistant here logging in sample. So this is a tube station. Basically, a lot of samples from the wards. People don't carry the samples down to the lab. So there's a tubing system that actually shoots down the sample to us. So there are these carriers and they would just drop down, and then the lab assistants would open the carriers and take the samples out. So now once they gather all the samples and then make sure that the labels are put on, they're going to be delivered to different departments. So the main disciplines or main departments at VGH would be hematology, chemistry, transfusion medicine, microbiology, and anatomical pathology. So I'm going to briefly talk about each department, what they do. So hematology is what I have been doing in the last 8.5 years. So I should know pretty well what I do in this department. Hopefully I'm not giving wrong information. But essentially hematology is a study of blood cells. So when you are sick, your body is going to be fighting the infection. So some of the cells that are helping that are the white blood cells. So all right here. Now your body needs a lot of oxygen, and to have the delivery of the transport of oxygen, you need red blood cells. So here, and platelets to help clotting. So when you're bleeding, you don't want to let blood keep bleeding out. So platelets are going to be one of the many things to help the clotting process. So all these are from the bone marrow. Your bone marrow is kind of like a factory of producing all these blood cells. So these are the analyzers. These are actually old analyzers. We have changed to newer analyzers. But essentially, this is the analyzer that we use to count the blood cells. So the lab assistants would load the samples and go over here. And then the analyzer picks up the sample and then does a magic behind the scenes. And voila, we get a result. Actually, it's a lot of results on the sheet of paper. But essentially, it gives me a white blood cell count, a red blood cell count, a platelet count. So a lot of information on that piece of paper. In fact, we don't even get a piece of paper anymore. A lot of them are actually going through a computer system that we see on the computer on the patient's results. So a lot of times we actually don't even need to look at the results. However, if the analyzer flags that, oh, looks like something is a bit abnormal, then it would actually prompt this machine to make a slide. So it's a glass slide and then makes a blood smear. So once it makes a blood smear, we can use a microscope to see different kinds of blood cells. So these are actually microscopic pictures. So red blood cells, platelets, and a bunch of white blood cells. Now, if we need to look at glass slides for a whole day, oh my goodness, we're gonna be working, I don't know how many hours. So automation actually plays a big role in our job right now. So a lot of work are now done on a computer. So this machine can actually take pictures of the white cells so that when I, being the technologist, looking at those cells and see, okay, these are all neutrophils, okay, eosinophils. So the job is actually much easier for us. But the thing is, technology is not perfect. So I still have a job because the machine does not do a perfect job. If the machine can do a perfect job, I would be jobless. So my responsibility is actually to make sure that those cells are correct. And we don't 100% rely on computers and technology. Human eyes are still the best. So another department I'm going to talk about is chemistry. So it is basically the analysis of all chemical components in different body fluids. So in blood, you see all these chemicals. I'm not going to go through all of them because in this department it can actually run almost 100 different chemicals. But a lot of these are very basic. A lot of physicians would order. If you have had your blood test, you might have seen some of these results. So such as a sodium, potassium chloride, these are very basic. Now, I'm going to talk about the cardiac markers since we are in the field of doing first aid. And of course, we talk about having cardiac arrest or, you know, those cases, right? So when a physician suspects that it's a cardiac case, they would right away order a troponin. So troponin is basically a protein from the heart, and normally you don't see it in the blood. Now, if someone is having angina or having basically the heart tissue, heart muscles is dying, this chemical is gonna be released into the blood. So it's a very valuable chemical that we can see to show that, oh, someone is actually going through some kind of heart disease, some kind of heart problems. So Another thing, well, when we run as sims, we simulate that there are going to be like drunk people. So another thing that we test for is the alcohol level. So ethanol is the most common. So on a Saturday, actually Friday night, doctors order a lot of ethanol because a lot of drunks would actually go through the emergency. So it's a very common test, and yep. Now, this machine here basically sorts out those blood samples, and then it sends through to this machine, which is a centrifuge. So blood actually, well, it looks like all red tube, but when you spin it down, it actually separates into actually 3 layers. So what we're interested in is actually a top layer, which is called serum or plasma. So now these are the analyzers that we use. There are actually 3, 1, 2, and 1 more in the back. So they're huge, and they actually are free. Why is it free? Is because in medical field, lab in particular, analyzers actually don't cost much. Reagents actually cost a lot of money. I believe VGH, this department, each month, $300-something thousand easily spent on reagents. So it's a very expensive running. So now urine testing, not the best kind of body fluid to see or smell, but it is part of job to actually look at these specimens. So something called macroscopic. So we also call it dipstick. When we dip using this dipstick, we can tell if there are any blood cells, any protein, glucose, bilirubin are present in the urine. So sometimes it's normal for blood cells to be present if it's very little, or if it's in female who are in having period like that. So that is considered to be normal. But in general, proteins, glucose, bilirubin, all these should not be present. pH, we also measure pH in the urine. So it should be in a certain range. So now, macroscopic work is actually being analyzed on the analyzer, but when the analyzer flags that, hey, something looks abnormal, then we look under a microscope. Then we can tell if there are any things like crystals, bacteria, or something called cast being present in the urine. So these are not something that's normal. Okay, so one more question that I want to see when we get into the transfusion medicine. So if you can go to this link and answer this question. Do you know your blood group? What is your blood group? Okay, so I have the results here. 40 people answered. And as expected, a lot of people actually do not know their blood type. And as you can see here, I'm actually a bit surprised that group O is only 8 people. Group A, 12. Group B, 6. And the least is group AB. Good to know. So this is actually pretty, not the best representative, best representation of the whole general population. But it is true that group O and group A are the most common. So good to know. And yes, in fact, a lot of people do not know their own blood type. So now, transfusion medicine, this department deals with blood group check. So when a sample comes in, basically would test for what kind of blood group it is. So you might have heard of a universal donor and universal recipient. So being O minus is basically the universal donor. I sometimes get confused myself too. So basically, this is how compatible it is. If you are O minus, the minus and plus is basically called rhesus factor. So I'm not going to talk about that. But basically, if you are group O minus or negative, then you can receive only O minus blood type. Okay. Whereas if you are AB positive, you can receive all the people's blood. Now, when I'm talking about blood, I'm only talking about red blood cells. There are other components in your blood right here. So these are red blood cells, and there are also platelets, and also something called plasma. So this department is also in charge of giving out all these blood components. So if there is a massive car accident and someone's bleeding out very badly, so then this department would be responsible to hand out all of the red blood cells, like these packs, and give it to the nurse, and they can give it to the patient. So this is also, we call it blood bank. So as you can see here, there are a lot of blood in this fridge. So microbiology, this department is to isolate, grow, and identify the pathological bacteria or yeast. So there are different kinds of specimens. Not all bacteria are bad. The most important actually is to identify the pathological, the bad ones. And it is very important to know which kind of bacteria, because you might have heard of antibiotic resistance. If we give random antibiotics to patients, eventually there's a high chance to deliver something called the antibiotic resistance, and that is not good. So these are the plates that we use to culture bacteria. And this is a microbiology department, which has different benches in different areas. And the last department I'm going to talk about is anatomical pathology. Basically, it processes different kinds of body parts or body specimens to an observable cellular level. So some of the parts can be organs. I've seen whole liver, I've seen the whole spleen, limbs, I've seen the whole leg coming in. So bones can come into basically essentially any part that is of value of the body part that can actually come in. So the whole point is actually to diagnose any neoplasms, so basically abnormal cell growth. So you might have heard of, well, cancer. Basically, it's malignant tumors. So the specimens would come in possibly in buckets, in some kind of chemical called formalin, and then basically they're being processed through different stations. And then we put it into something called put on a slide, and then get it stained, and then we look at it under a microscope. All right, so some of the responsibilities that John, the things that we do, again, blood collection, which we don't commonly do anymore, unless the technology is working in a small hospital. So we do a lot of preparation and analysis. So now dealing with analyzers, a lot of those big machines that you've seen, and of course, microscope is probably our best friend. So we prepare and verify the lab results. So we need to make sure that they're accurate. And we communicate these results to other healthcare providers. So it could be nurses, could be doctors, could be so many others like respiratory therapists. And we also need to do a lot of maintenance. All these instruments, they are like babies. So they need a lot of attention. And we need to make sure that they run smoothly so that we can get the correct lab results. Now, COVID, since we're in a pandemic, a lot of focus is actually on the virology lab. And a lot of people hear about the medical lab is because of the COVID testing. So it is a lot higher workload during the COVID period, particularly in this virology lab. So during April, mid-April, I believe it started at St. Paul's and BCCDC, and they did over 130,000 COVID testing. It's actually a huge number. So in my department, hematology, we usually do like 1,000 to 2,000 samples per day. To actually have that many samples in those 2 weeks were extremely high volume. So I heard my colleagues were actually really worn out because they had to do a lot of overtime to help with the COVID testing. So some of the labs that do testing would be BCCDC, so BC Center of Disease and Control. Some large hospitals, so BCEHS, St. Paul's, I think Surrey Memorial, they're all capable of doing COVID testing now. So Life Labs can do it too. And also there are some other private labs that can do COVID testing. So this is a page that we like to go to and take a look. So this is last updated April 23rd. And as you can see here, the total cases, like active cases are actually here, and the number of cases today, and today is actually not, this is actually the date, April 23rd. But basically, as you can see here, there are total tests that were done, and it's a lot. So we are pretty proud of being able to deliver so many testing in BC. It's actually quite a lot of work. So the test that we, the technical term is called COVID-19 PCR NAT, nucleic acid amplification test. So this is the primary choice for testing. And it is very sensitive and it is very specific. So when we do testing, there are sometimes a lot of other interferences, but with this test, it's actually very specific to testing the COVID virus. So the turnaround time is about 1 to 4 hours for clinicians. And what is of value is that it can show if there's an active COVID infection. Now, before there's so many samples coming in, a doctor actually figured out that, hey, well, most people are actually negative. What we can do is pull a bunch of patient samples, I think it's about 20 something, and pull together and then test it and see, okay, if this batch, all these 20 samples tested negative, good. Then all these 20 samples, 20 patients are actually negative for COVID testing. If there is one positive case, then this whole batch, all these 20 samples are going to be tested individually and see which one is actually positive. So it's a pretty smart idea. It actually helps us save a lot of cost and time. Something called serology. So it detects the presence of antibodies in the blood. but it is not actually recommended to use in a diagnostic for that kind of purpose. And it's usually used for clinical research. So why we still do this is because it can help determine if a person has been infected with COVID in the past. So if you are infected before, your body should produce something called the antibodies. So we should be able to detect that. Now, there's also some faster ways to do it, something called point of care or rapid test. So these are very small devices, but they're only screening tool. It doesn't need a medical lab to generate the results. They are in general very low sensitivity and it's not as accurate, but it truly still has value. So now remember, a negative test result does not totally rule out a COVID-19 infection, okay? You might have heard a lot on the news about this too. Now, COVID, of course, is under the spotlight, but we have to remember that there are still a lot of other viruses and bacteria out there that can actually do a lot of harm to our bodies. So keep in mind. Okay, so I want to do 2 case studies. So the first case study, so a 56-year-old male found unconscious on the street. The bystander called EMS and cannot provide any relevant history. So when we do an assessment, airway, breathing, circulation, they're all normal, except the face appears abnormally yellow. GCS is 3, unconscious. There are no medical bracelets, no medications found when you do the primary and secondary. So now, what could have happened? So if you can, in the chat, feel free to actually type your diagnosis. What could have actually happened? So I'm gonna go into the chat. Okay. So what do you think is actually going on with the patient? Okay. So I'm seeing cardiac jaundice, in the case liver failure, okay. Could be anything. Some put down, okay, renal, okay, good guess. And there's no right or wrong, and well, there's actually one right answer that I'm thinking of. Okay, liver failure. Well, totally unconscious. Septic shock, okay. All right, so these are all good guesses. And let's take a look. Now, the Emerge doctor ordered all these blood tests and reveals that the liver enzymes are extremely high. So in my previous slide, talking about chemistry, there's something called a liver panel consisting a bunch of liver enzymes. So if someone is having a liver problem, their liver enzymes are going to be very high. So this patient also tested positive for cocaine. So the diagnosis is chronic alcohol consumption leading to the liver failure. So I have a bottle here of, you can think of what kind of alcohol it is, but basically killing the liver. Okay, so my last case study, this case is actually very close to me because I actually had a chance to really see this patient. So the paramedics are called to attend a 17-year-old male at home. So the chief complaint is severe difficulty in breathing. And the history the mother reveals that the patient was seen by a family doctor 1 week ago and was diagnosed with a severe cold. The condition had not improved since then. So paramedics assessed the patient, and the patient was having heavy and difficult breathing, increased heart rate, and the GCS is 15. So by skin, it looks pale, cool, and dry, but auscultation sounds a bit weird. So with all these information, again, type out your what kind of diagnosis. And remember, we as first aiders are not to diagnose. But in this case, what can you think could be wrong with the patient? We'll take a bit of time and you can type it out. Okay, I see flu. Okay. Any other guesses? Broken lung, yeah. Anxiety, good. Pneumonia, Pneumonia. So a lot of people are now thinking some kind of lung issues. Any other guesses? Okay. All right. So pneumothorax. All right. Good. All these are really good guesses. Now, the treatment part, the patient was rushed to VGH by the paramedics, and the chest x-ray reveals that there is a massive amount of fluid in the chest cavity, and the chest drain tube was inserted. So when they drained out those fluid, they're almost 2 liters. And soon right after, the patient actually coded and passed away. So what actually happened? This case, I actually had the chance to go to the morgue and watch the autopsy. That's why it's still very vivid in my mind what actually happened to this patient. So how come it's very of lab value? Because this person actually died from something called leukemia. It is a blood cancer. And under a microscope, we can actually see a bunch of these abnormal cells. So it turns out that the patient died because there is a huge tumor. It's a fist size on top of the heart, and it caused the fluids to build up in the chest cavity. And then when those fluids are drained, it actually led to acute fluid loss and imbalance. And ultimately, the patient decompensated and passed away. So yeah, it was a very young patient and unfortunately passed away due to leukemia and not flu. In fact, a lot of patients come in like a flu with flu symptoms. They didn't know that these patients with blood cancer, they all thought that I'm actually fighting a flu. But then when they came into VGH, oh no, it's actually something much more serious. Okay, some references, and thank you very much. And I am gonna open the floor for any questions. Sorry, I took a bit longer for presentation, but yes, I'm welcome any kind of questions.
Thank you, Mr. Leung. That was a very informative presentation. Have to be focused all the time.
I'm sorry, it's such a heavy kind of presentation.
Okay, so I'm the Divisional Training Officer of Division 389. I'm Garfield. I think I introduced myself before, but if you forgot, I just refresh your mic. Sorry.
Good to see you again.
Nice to see you, sir.
Yes.
Now we have some questions for our cadets, and And also after that, we will open the floor to questions by anyone here. If you have any question for Mr. Leung, just prepare for that. So I would like to invite Corporal Yip to present our first questions. Please go ahead, Corporal Yip.
Good evening, Mr. Leung.
Good evening.
My name is Corporal Alana Yip, and tonight I would like to ask, do you have any advice for those of us who may be interested in going into the medical field?
Yeah, absolutely. First of all, if you're thinking of being a medical doctor, good for you. But I actually, in my mind to do this presentation is actually to showcase in the medical field, there is a lot of other jobs. So in a lot of people's mind, they think of being a doctor, being a nurse, but a lot of other medical jobs are actually not as popular. So just like mine, being a medical lab technologist, honestly, when I was in school, I haven't even heard of it. But then it's something that if you're very interested in the medical field, and well, I actually didn't have the intelligence to be a medical doctor, and my sister is one already, so she can be the one in the family. Well, actually, take a look at other medical jobs. It doesn't need to be a medical doctor. Yes, a lot of people do focus and think of that highly, but I just want to tell people that there are a lot of other choices. And I also have heard of a lot of people didn't like being a doctor. So this is something that I just want to tell people about.
Okay, thank you.
You're welcome.
We'd like to have the question from Corporal Butler, please.
Good evening, Mr. Leung. I'm Corporal Butler.
Good evening.
My question for you is, what was your main motivation to move over to the BC Cancer Agency from the Vancouver General Hospital?
Good question. It's actually very different from my previous job. So at VGH, it's a lot of diagnosis that we do. So the last case I presented was the case of a blood cancer. So a lot of times we see sick patients, and there's another side of things is actually the treatment part. So now my job is actually to prepare the life-saving material. So again, some of the stem cells to be infused, given to those cancer patients. So this is absolutely a different side of things. First of all, we have the diagnosis part, and now I'm on the treatment part. So it is very rewarding to actually see patients getting the treatment. When I go to the ward and prepare those cells to give to patients, they're very happy. Whereas when I was at VGH, I had to do something called a bone marrow examination. So that's involving sticking a needle that this big into someone's something called pelvic bone and get a sample, and they're suffering. Now I am on the other side of things to see patient having that moment of joy is actually very different, and that is what I would like to see.
Thank you.
You're welcome.
Good evening, sir. I am Squad Leader Shum. I would like to ask, why did you work in the medical field and what made you pursue this profession?
So I think when I was a kid, I've been thinking about being a doctor, yeah, for a long time. And turned out that, well, I am not as intelligent as my sister. I was pretty bad in school. I didn't like studying when I was in Hong Kong, and then I came here in 2001, and then figured out that, okay, maybe I should start studying. And that's when I started thinking about like, okay, maybe I can still get into the medical field. And then my friend who worked at BGH as a medical lab technologist told me about this job. And that is how I actually got into looking into this job, what it actually, what's about this job. I haven't even heard about it before, to the point now that I'm actually working as a medical lab technologist. So a lot of times you need to hear from other people and tell you what kind of other medical jobs out there, but also do some research. And that's exactly what I did.
Thank you, sir.
You're welcome.
Good evening, Mr. Leung. I am Squad Leader Lau, and I would like to ask if you have any future goals.
Future goals, traveling. I want to travel. I don't know if that's a goal, but also now that I just got married half a year ago, so things are actually shifted from thinking about work all the time to, hey, maybe eventually having a family, who knows? So something different, not thinking about work, but have different kind of goal in life.
Thank you.
You're welcome.
Good evening, Mr. Leung. I am Corporal Chen. So this is kind of like an additional question to the one you had before. As you enjoy traveling and have been to over 20 countries, where would you want to go next when the pandemic is over?
Portugal, Europe in general. I spent time in Spain and I absolutely loved it. Unfortunately, the time that I couldn't actually spend time going to Portugal, and that's actually one place I really want to go. And there's so many other places, but I'll keep Portugal as my top list right now.
Thank you, Mr. Leung. And I think that is all for the questions that we have from the NCOs. I will pass it back to Ms. Huang.
Thank you.
Thank you, Corporal Chen. So now I believe Mr. Leung is ready for our open floor questions. And I saw Ms. Jane Short have her hands up.
Thank you. Thank you so much. So I wanted to ask, have you done any work in stem cell research and looking for stem cell matches or anything in that field?
Right. Stem cell research is actually a different kind of department. So what I currently do is on the clinical side. So with a lot of stem cell research, a lot of people might have heard of One Match, that program. So there's a lot of things that are being done on the other side of things. In regards to what I do is mostly confined into actually doing the treatment side of things. So when those stem cells are being taken out from either the patient or someone else donating, those cells they have to be prepared, and then that's how we give it to the patient eventually. But no, we don't do research on the stem cells.
That's awesome. That's so great. Thank you.
Yeah, you're welcome. Thank you.
Before I joined St. John Ambulance, I worked for Canadian Blood Services. And one of the things I occasionally got to do was go and visit some of those stem cell donors. So it's so great for me to have this moment of coming full circle and meeting somebody who was behind the scenes in the labs. And here we both are now with St. John Ambulance. It's a wonderful feeling.
Absolutely.
So thank you for your presentation.
Thank you very much.
Okay, so if no one else have question for Mr. Leung, then of course it's my turn. For those who been here for a couple times, must know that it's my honor to be asked the last questions for the day. And most of you might know what questions I'm going to ask. So please, Mr. Leung, answer my questions with your heart. No lying, be true. What is your favorite ice cream?
Oh my gosh, that's actually very, very hard. Tough question. So first of all, I would isolate to one place, which is called, not trying to sell, but Ernest Ice Cream. That's where I usually go to get my ice cream. But whiskey hazelnut is only one of my favorite, because I have a lot. Matcha ice cream, love it. I'm sorry, I'm listing a bunch of them, but yeah, too many is my answer.
Thank you. I hope you like the whiskey walnut. It's because the walnut, not the whiskey.
I think whiskey is only for flavor. There's actually no alcohol in there.
Thank you very much.
Thank you.
Mr. Leung, thank you for answering all these questions so in-depthly. Do you have any closing comments?
Well, again, thank you very much for opening this platform so I can share some of my what I do. And I think there are a lot of young people in this group and really have an open mind to think about what I can do in the future. Don't limit yourself. There's just so many things out there. Do not confine yourself to just thinking into doing one thing, because you never know how it turns out to be. So I am very happy that I got into this field, and volunteering in St. John, it actually, I can relate to a lot of things, also in the job. So keep an open mind and do whatever you like to do. So yeah, thank you very much.
Thank you very much for your informative and inspirational presentation.
Thank you.
Thank you for all you do behind the scenes during the pandemic. Mr. Liu, back to you.
Thank you, Mr. Lowe. That was a very good Q&A session by our NCOs, and with the open questions by everyone else as well. And very informative on what goes on behind the front line. A big thank you to Mr. Leung, Ralph Leung, for his wonderful presentation this evening and inspiring our members. Let's everyone give him a big thumbs up. Awesome. On behalf of the Burnaby Division, I also want to take this opportunity to thank Mr. Ken Leggatt, the interim CEO, who supported our virtual initiative from the start of his time as CEO and throughout these many challenging months. So thank you, Ken. I truly look forward to shaking your hand or elbow bumping in person one of these days soon. We look forward to welcoming Mr. Ty Spear, who will start in exactly 1 week as the new CEO of St. John Ambulance, BC and Yukon, in time for our next speaker series event. Speaking of which, this year being the 75th anniversary of Canada becoming a St. John Priory, and the 110th anniversary of for BC as a provincial St. John Council, we will continue to safely mark our double anniversary year with these engaging events. We are very delighted to announce our next presenter for May 10th with Commander King R1, one of our former provincial commissioners, who will share his journey with St. John Ambulance as we celebrate the 25th anniversary of Asian Heritage Month during the month of May. This concludes our speaker series tonight. Thank you again for joining us this evening. Good night, stay well, and have a great week, everyone. One St. John.